So I decided to do temporal arteritis. This is a form of vasculitis or inflammation of the blood vessels. It's also known as giant cell arteritis or Horton's arteritis. Excuse me if I'm not saying this right, but this is how I'm going to say it the whole video because my PowerPoint wouldn't upload. So, temporal arteritis, which your temporal arteries, which supply blood from the heart to the scalp, are inflamed and constricted. The vasculitis that causes the temporal arteritis can involve other blood vessels, such as the posterior capillary arteries, which, when affected, can lead to blindness, or the large blood vessels like aorta or its branches, which can affect the heart and cause all types of other serious health problems. Who does this affect? It is one of the most common vascular disorders, but it is relatively rare anyways. It affects about 5 in 10,000 people, usually occurring in people over the age of 50 and more likely to occur in women than men. They don't really know the causes. It's pretty poorly understood at this point. So far, all they really know is that it's a faulty immune system and that the immune system is attacking its blood vessels, causing inflammation and constriction. There's no well-established trigger or risk factors at this point. They do know that it's most commonly connected to people who have polymyalgia rheumatica. Signs and symptoms. Most common symptom is a throbbing, continuous headache on one or both sides of the forehead, obviously affecting mostly your temporal area. Fatigue, fever, jaw pain that becomes worse after chewing, tenderness at the scalp and temples, vision problems such as blurred vision, double vision, transient vision loss, and if this isn't treated, again, this could cause blindness if you damage those blood vessels due to poor blood flow. Muscle aches in the upper arms or shoulders, hips, upper thighs, lower back, and buttocks. A lot of the time they have a loss of appetite, therefore they have weight loss. This is mostly diagnosed by a good physical examination and listening to the signs and symptoms that the patient is having. That way that the doctor actually considers the disease, and then they would run blood tests such as the erythrocyte sedimentation rate or the C-reactive protein to see how much inflammation is going on, and they'll test for anemia because 9 times out of 10 they're anemic. The doctor will order a biopsy to see what is causing the inflammation. The doctor may order an MRI, a PET scan, or an ultrasound just to see a more clear vision of what's going on with those blood vessels. If we do not treat this quickly and get it diagnosed promptly, eyesight can be damaged, causing sudden blindness in one or both eyes. Blood vessels can be damaged, causing an aneurysm. This can also cause a stroke or transischemic attack, like a mini stroke, because obviously if it's constricted, it's going to cause less blood flow through the body, through those vessels, which less blood flow to your brain causes a stroke. There is no cure at this time, but they should start treatment as soon as possible. At this point, glucocorticoids are the go-to treatment. They are on them up to 2 years. New medication called tocilizumab, which it's spelled Tocilizumab. So yeah, you say that. And that's just a subcutaneous injection They can't smoke, and they need to keep alcohol to a minimum. Their prognosis is good, especially if it's caught early and treatment started promptly. The most complications that are associated with this disease actually come from being treated with steroids. It's not actually the disease itself, such as the being more at risk for infection or osteoporosis, which a lot of the times doctors will put them on calcium and vitamin D supplements just to kind of prophylactically treat that. And that's my video.